Hello viewers, welcome once again to my YouTube channel. I remain your humble friend Obichukwu Daniel Aniekwe. I'm a medical doctor by profession. You can call me Dr. Order. Today once again I'm going to be giving my discussion on convulsion or seizures, especially in children, the misconception. Like I always say, I'm not here to give lecture to medical doctors or medical students. I'm here to give advice. Therefore, I'm going to speak simple English, not medical terms. I'm here to guide my viewers, especially parents, mothers, caregivers, and everyone that will come across this video on the right perspective, the right thinking on health issues, different health issues. So today is all about convulsion, or what we call febrile convulsion in children, or seizure disorders. Over the years of my practice, almost 10 years of my practice, I have heard so many things about febrile convulsion. People say so many things that when a child is convulsing, somebody that is convulsing or having seizure should not be given injection. If they give the person injection, the person or the child will die. And a lot of people practice a whole lot of things. They put spoon in the person's mouth. They said it's going to prevent the child from biting the tongue. They use all manner of herbs, concussion, putting in the person's mouth, in the eyes, rubbing it in the eyes, during convulsion, febrile convulsion, the child eye will be rolling up, the child will be shaking, there is this agitation, there is this fear, panic, confusion. That is why it's called an emergency. In pediatrics, we call it pediatric emergency. Okay? So, what's febrile convulsion? Is something that happens in children, especially between the age of 6 months, 5-6 months, till about 6-7 years. Okay? Now, I want to tell us that in convulsion or in seizure disorders, you don't need to practice most of the things we do, like rubbing all manner of concussion in the child's eye, putting spoon in the mouth. A lot of people have used that spoon or object. People put spoon, they put stick, they put whatever that comes to their hand. They have used it to injure the child or the patient beyond the condition that he or she has. So it is wrong to do that. And it is wrong to say that somebody who is convulsing, a child that is convulsing, or somebody who is having seizure, whether epileptic seizure or any other type of seizure, should not be given injection, that the person is going to die. I want to tell you a story of what happened in my clinic, I think last week, very recently. A child was brought to the clinic, 2 years plus. For the first time, this child convulsed and had repeated episode of febrile convulsion. And at home they have done so many things, practiced so many things, used different things, onions, herbs to rub on the child's eye. So when this child eventually presented to the clinic, and they told them, let them not give injection, they were saying it, but because they are there already, they don't have choice. They have tried all they could at home. The child didn't respond. So Because of that, they have to go to hospital. Thank God they took that decision, because some never did. They said it's a herbal drug. They said it's a traditional thing. Some will tell you it's witchcraft, that their enemies are after them, and all that. Before you know it, somebody will die. So when they came, they have no other option than to allow us do what we know how to do best. So injections were given, and after all said and done, we were able to arrest this convulsion. The child went into sleep and slept and slept and slept. We are like, wow, this child is oversleeping. I reassured them and told them that the child will wake up, and when he wakes up, make sure there is food to give to the child. Now, when eventually the child woke up, now their problem is no longer that the child, is not waking up. Their problem now becomes that the child cannot see. That this child cannot see. Doctor, the child cannot see. Nurse, that the child cannot see. I simply told my doctors, my nurses, and those around me, before the patients, relatives, the mother, the father, the neighbors, that these people know what they practice. They have used several concussions, several things to rub on the child's eye. That is why the child is having blurred vision. Because they were not hiding. Could it be the injection? Could it be the drugs? They've said before they don't give them injection. I told them, don't mind them. They are hiding. If they don't want to tell you the truth, don't mind them. Later they opened up. They said they rubbed all manner of concussion on the child's eye. And that was what caused temporal blurring vision to the child. But eventually the child's vision was restored after, when all the things they rubbed on the child's eye must have cleared. Now, when they said that, I told them, now that you've seen that this child was given injection and the child did not die, rather the child was saved by God's grace and the child is alive. When you go back to the community where you live, please spread this message. Tell them that it is not true. Because for everyone that is saying this, when you ask them, how do you come about this information? They will tell you that is what they say. That is what my mother-in-law say, my father-in-law say, my mother say, my neighbor say, my father say. That is what they say. This is what I call street knowledge. Knowledge that are unfounded. Knowledge that you cannot hinge on any scientific evidence. So it is not true that when you give somebody that is having seizure or a child that is having febrile convulsion injection that the person will die. No, it's not true. Actually, it is with that injectables that you are going to control the seizure. Because at that point, our people, whatever we don't know, we don't understand, is a mystery. We start speaking against it. It's either we start condemning it or we start relating it to spiritism. If a child is convulsing, the teeth are tight and everything, how are you now going to administer oral drug? So it is by through injection that you are going to arrest this situation. So I want you to help me spread this good news, this message. The essence of making this video, saying all these things, is to help our people, to save people from dying, especially our children. Please stop saying that. If you've been saying it before, stop saying it. Now you're hearing it from a medical doctor. That is not true. Anybody that tells you that, ask the person, where did he get his or her information from? Ask the person, are you a medical doctor? Just simply know that this person is not a medical doctor. It doesn't matter who else that says it. Sometimes some people will tell me they told me in a hospital. I say, who said it in the hospital you went to? They will be looking at me. Because if you don't get it, there are so many people working in the hospital, ranging from cleaners and receptionists and all that. So you can't just say somebody said it in a hospital. Who said it in the hospital? Does the person has that professional authority to speak on that issue? You understand? So, my dear friends and viewers, you have seen it today. And when a child is having convulsion, simply what you should do is just to take the child to the nearest hospital or health center, or even to a pharmacy or a clinic. They know what to do. And remember, once a child has convulsion for the first time, nobody is to be blamed. But subsequently, we don't like it. We don't want it to repeat, because it can cause brain damage, especially in young children, in infants. Therefore, once a child has the first episode of convulsion, or first history of convulsion, the caregivers or the parents must note it and continue to tell the history in subsequent hospital visitation that this child has febrile convulsion. So once a child convulses and the child falls sick any other time, take the child to the hospital and tell them that he used to convulse, so that they will prevent the child from convulsion. You understand? So it's very, very important to take note of this one. So once a child is convulsing, take the child to the hospital immediately. There's nothing else you can do at that point. Take the child to the hospital, okay? And they know what to do. Not to sit down and start postulating and saying all manner of unfounded things that's causing trouble to our people. So please do it immediately, because it's an emergency. Thank you for listening to my video, for watching it. Please remember to like this video, to share it, to comment on it. Are you getting what I'm saying? And remember to click on the button for notification, so that once new video emerges, you are going to see it and get the right information from the right source, from the approved source. Thank you, and God bless you. Bye. See you some other time. Bye-bye.